Dr. Majid Abdi is kicking his legs for the keynote lecture. Dr. Naeem Laghari is also eagerly waiting. Dr. Nadeem Bajwa is also eagerly waiting for the keynote lecture. And I will proceed to the Dr. Vajdev is also here. Dr. Vajdev, I was also mentioning your very good work for the website. You were here. So moving to the first keynote, thematic lecture of the night, and he graduated from Khyber Medical College. He moved to United Kingdom for his fellowship in psychiatry. He came back to Pakistan, established a psychiatric department in Lady Reading Hospital, Peshawar. Later on, he moved to Khyber Teaching Hospital and also chaired the unit of psychiatry department. He became the principal of Khyber Medical College in 2004. He also had the role of President Pakistan Psychiatric Society. He chaired South Asian Division of Royal College of Psychiatry, United Kingdom. He was formal zonal chief of World Psychiatric Association. Currently, he is chief executive Horizon Ibadat Hospital. He has authored many books and also many research articles. He will be talking about the mental health of mental health healers. Ladies and gentlemen, please welcome Professor Khalid Mufti.
Bismillahirrahmanirrahim. Nahmaduhu wa nusalli ala rasulihil kareem. Amma ba'd. It was a great honor for me to be here tonight, invited by the Pakistan Psychiatric Society. So, thank you very much, the President, Pakistan Psychiatric Society, the Cabinet, all the 5 chairs from Pakistan, and my splendid colleagues who are sitting here and even, who have contributed a lot. Ladies and gentlemen, the first thing which came from the hall, some people sitting here, is poetry. So I think we'll come to that after a serious note of discussing today's important topic, healing the healers. Ladies and gentlemen, I begin my talk from the message which I have chosen from the book The New Directions Transforming Our Lives. John Nesbitt is a motivational speaker in the United States and was very popular in 1980s. He said that in turbulent times, in times of great change, people head for the two extremes, fundamentalism and personal spiritual experience, where there is no membership or even a coherent philosophy or dogma. It is difficult to define or measure the unorganized New Age movement but in every major city, thousands who seek insight and personal growth cluster around a metaphysical bookstore, a spiritual teacher, or an education center. And I remember in 1997, the best-selling book in United States was selected poems from Maulana Rumi. And my personal request will be that I'll really relearn and appreciate if there is a little silence. It will not be more. I'll try to finish it in time. I thought to choose a topic which is serious, which is challenging, which is really a catastrophe, and where the physicians are involved, healthcare workers are involved, including the psychiatrist, and that is, COVID-19. The spread of this COVID-19 across the globe is colossal. One such unrecognized area, although there are some other unrecognized areas, but one such is mental health issues which are developed in the medical staff during the pandemic, and the President Psychiatric Society also touched on this point for a while. During COVID-19 pandemic, female frontline healthcare workers, they have faced immense psychosocial pressures ranging from unsupportive family norms, unwelcoming working environment, insensitive hospital administrators, and rumors spreading all over about the COVID-19, as well as some of the missing incentives, no incentive for the hard work which doctors do, particularly the ladies. This is a Pakistani paper by Shahbaz and Ashraf in BMC Women's Health, quoted in a large number of publications. At least 1 in 5 healthcare professions, they report symptoms of depression and anxiety. Almost 4 in 10 healthcare workers experience sleeping difficulties and insomnia. The rate of anxiety and depression were higher for female healthcare workers and nursing staff. Mild mood symptoms are common, while mild and subthreshold symptoms like health anxieties are also not monitored properly. Now, health anxiety, which I refer here, and I was myself a little bit muddled initially, but I found out the definition by the same authors that health anxiety is an obsessive and irrational worry about having a serious medical condition. It is also called illness anxiety. Recently, also, this subject is touched upon by WHO. Now, the pandemic is likely to put our healthcare workers across the world in an unprecedented situation, making impossible decisions, that is, work under extreme pressures. We all know how to allocate few resources to needy patients, and how to balance their own physical and mental health needs with those of patients, very important, and how to align their desire and duty to patients with those to family and friends, how to provide care for all severely unwell patients with constraints or inadequate resources. The same thing applies in Pakistan these days. And this may cause some to experience moral injury or mental health problems, which I'll let you know. Moral injury is a term that originated in the military in Second World War and can be defined as the psychological distress that results from actions which violate someone's moral or ethical code. It's unlike formal mental health conditions such as depression, PTSD, moral injury is not a mental illness, but those who develop moral injuries may ultimately experience they experience more negative thoughts about themselves and about others. For example, I'm a terrible person. My boss he doesn't care about patients' lives. Particularly the medical students, they fall in this kind of category. We have also noticed in our time that we might have been suffering from this moral injury. Now, in contrast, there is a resilience. And people who accept and are contented with significant challenges, moral or traumatic, a degree of PT, post-traumatic growth, a term used to describe strengthening of psychological resilience, esteem, outlook, and value after exposure to highly challenging situations. What are the signs of post-traumatic growth? We know, we have been listening that in COVID, some people have grown as well. Appreciation of life, relationship with others, new possibilities in life, personal strength, and spiritual change. Whether someone develops a psychological injury or experiences psychological growth is likely to be influenced by the way that they are supported before, during, and after a challenging incident. Now, the medics and the mental illness is quite common amongst doctors. Suicide rates are higher than for most other professional group. Today is the International Suicide Day. Personal, professional, and institutional stigma exacerbate mental health problems amongst doctors. Patient complaints are a significant factor leading to mental illness and suicide among doctors, particularly in the West, when they go for various kind of remunerations and legal issues. Prevalence of substance abuse disorder is similar to that of general population, and some groups such as anesthetists are probably more vulnerable. Now, suicide in healthcare workers, I thought it's an important thing, and by the day is also designated to come to just think deeply for action as the suicide for Suicide Health Day. For Suicide Day, there was a message that suicide may be ameliorated through action, not only by slogans. And probably the President, PPS, also pointed towards that. There is a large data regarding the impact of COVID-19 on physicians' mental health and suicides. There should be large data, but there is very little is available throughout the world. However, the stories published in the press regarding suicide by health professionals paints a grim picture. We lost our 2 psychiatrists last year through suicide. There are also stories of paramedics, nurses, technicians, and other workers in the medical field who have died by suicide during this incredibly difficult time. These few stories which reach the press are likely only a small fraction of the true loss of life during this time. There are several factors, ladies and gentlemen, that contribute to the higher rates of suicide seen amongst physicians. Number one, physicians have extensive knowledge of pharmacology, including the lethal doses of medications, which make suicides by overdose more frequently lethal than in the general population. Physicians also have increased access to potentially lethal medications within a hospital and their clinical settings, and physicians tend to use suicide methods of higher lethality including firearms and hanging. And this increased knowledge and use of highly lethal means equates to a higher percentage of suicide attempts by physicians being lethal. Now, I come to another topic within this for remedial purpose, and that is lived experiences, which we live as physicians, also known as experiential knowledge. I think Professor Oneza might be able to give more comments sometimes later, tomorrow or day after. A substantial proportion of mental health professionals have personal experience with mental health services. There is some evidence that those who have used mental health services may be more attracted to work in this field. This is a Western data and a very good article review, as well as an article in Lancet and BMJ came early this year based on the 2020 experience. Now, sharing personal experience can, in my view, humanize and strengthen therapeutic relationship. While it can be defined as the emotional impact and practical, spiritual, and existential insights that come while coping with certain types of distress in healthcare workers. Now, being aware of one's vulnerabilities is basic to the training of psychoanalysts. However, the explicit use of lived experiences in mental health care practice to date has been limited to only self-disclosures. Exposing one's own weakness, some people think there is an anti-group, while the group which criticizes this concept, they think of doctors as wounded healers, just to show your or disclose your lived experiences. They think they are like wounded healers, which carries negative connotation. The use of experiential knowledge does not necessarily entail disclosing someone's entire private life. It requires assessing what would be useful to patients as they recover from severe mental health distress and trauma. If psychiatrists choose to make personal disclosures, they should take place in a training or after a training or peer consultation context, after starting with sharing a personal recovery story and unraveling its key elements. I personally practice this kind of thing with peer support and with learning from few of my professors abroad, India, and one in the United States. Lived experiences are not only related to a specific diagnosis, but to broader insights related to life, such as knowing how it is to live in different realities, surviving emotional or physical trauma, and suffering from loneliness or social injustice. Psychiatrists who talk about their own struggles in these areas could serve as a positive role models for their team and patients, a personal experience. Now, to summarize up till now, whatever I said, is that we conclude that the rationale for using lived experience may be increasingly accepted in the mental health settings. However, psychiatrists appear to have reservations about this development and may hesitate due to assumptions related to their profession as well as a lack of training. Patients seen to benefit from this kind of intercourse is nurses, social workers who share their own lived experience. Further research on this is important, and it should apply to psychologists, and psychiatrists, which may start taking this research. Now, Professor Imtiaz Dokar in the beginning said that the the health is biopsycho-socio model, and they involve all these things. I think after you hear this, and I think many of us will agree, that health is not only biopsychosocial, but it is biopsychosocial and spiritual, because we have forgotten about spirituality, but WHO is also thinking to bring the term spirituality. Religious coping comprises cognitive or behavioral coping techniques and often stems directly from an individual's religious belief system. Recent studies also suggest that religious and spiritual faith can provide comfort, emotional stability, and relief from stress. The interest in the topic of spirituality as a more or less independent dimension of quality of life is continually growing. Now, research about which coping strategies have been used to deal with mental health issues caused by pandemic has been relatively neglected. Furthermore, the role of religious coping strategies to manage pandemic-induced anxiety has been ignored. Furthermore, the research questions in this topic have started to change because also the fields of religiosity are changing, becoming more diverse and pluralistic. To address the new topics in health research, one may rely on standardized questionnaires. There are several. Some of them are, has a good evidence base, well tested. Several of these new questions cannot be easily answered with the instruments designed for previous questions. So the new instruments need to emerge. And I think Professor Farid maybe one day help us because he's very good in research. Some of these are inclusive, the instruments, also which embrace secular concept of spirituality and may thus be less specific, and others are rather exclusive or specific for different religious groups and thus not suited for every non-religious person. But I think we in Pakistan could look at this exclusive group. In my opinion, this issue should become a resource of relevant instruments in the wide range of organized religiosity, the individual experience of the divine, and the open approach in the search for meaning and purpose in life. Now, ladies and gentlemen, these are the things which I use, particularly in the COVID days. They are not evident, they are not being tested, but I just practice it, and I think people like Dr. Bashir and others may join together ultimately to test them more. I ask my patients, those who are under stress because of COVID, do you regularly offer your prayers during COVID-19? Now, many people, including in our house, those who had COVID, we started praying regularly. Don't want to name them. Nowadays, I seek forgiveness from Allah. Nowadays, I or you keep myself in wuzu. I read or practice Quran during COVID-19 pandemic. And nowadays, me or you regularly doing zikr, tasbih, recitation of Holy Quran. Nowadays, I regularly give more charity, sadaqah to needy people. I believe that only Allah can protect us and humanity from the coronavirus. Now, warning, there is a need for the monitoring of illegitimate or extremist religious leaders and groups affecting vulnerable and illiterate people opting for religious coping in face of health anxiety. And we should not be shy. We should come forward and take up that role, in a scientific way and as a healer. Now, the pandemic, there are few reflections. I will conclude with these reflections. The pandemic is catastrophic. Everybody knows. Terrible. Even today, we are fearing. I have a fear as well. For the survivors, the world will no longer be the same. However, attempts are made particularly by the groups of technocrats, capitalists, and narcissistic political elite to convince the new generation that life must go on as usual with the same greed, violence, and loneliness. However, if you and I are willing to be introspective, contemplative, and reflective, we are bound to realize that we must alter the rhythm of life and learn to live with humility, gratitude, and love. Only then it is possible to realize the depths in Quranic vision. I quote, when we identify with the life of all that exists, we realize that birth and death are a minor fluctuations in the ever-reaching cosmos. Now each of us has felt the need to be loved, touched, and listened. Each of us has realized that money cannot buy everything, and each of us has felt that nothing matters more in life than ecstasy of love. Love conquers fear, love makes death meaningful, love is more powerful than the vaccine, possibly the pandemic compelling us to ask this pertinent question: can we prioritize love over the power of money? Mindfulness. Can we see beyond the illusionary optimism of modernity and life negating experiences and despair? Possibly, as we acknowledge the reality of impermanence and uncertainty, we began to value the worth of mindfulness, the subtle, distinct art of living at this very moment. Our tomorrow is beyond prediction. Neither a doctor, nor an astrologer, nor anybody can predict whether we will be lucky to see yet another sunrise tomorrow. However, we can live and live deeply, intensely, mindfully at this very moment. Le सांस भी आहिस्ता, मीर तकी मीर says, ले सांस भी आहिस्ता कि नाजुक है बहुत काम, आफाक की इस कार गए शीशा गरी का. Thank you.